Hiya and welcome back to my channel where we talk about all things lipedema. So today's special guest is Nicola O'Brian, who is a UK-based podiatrist and also somebody who has been diagnosed with lipedema. So am I correct in... Yes. Am I correct in thinking you're the first podiatrist to diagnose lipedema as well?
I am the first podiatrist who has started diagnosing. It's still a little bit unofficial and under the table, but I am definitely a signpost for diagnoser, and I've been working to try and educate a lot of my profession. So it's still a little bit unofficial. However, as a podiatrist, most people don't know what a podiatrist is. It's a new name for chiropodist. We used to be called chiropodists many years ago. It's a long convoluted story I won't bore you with now, but we're now called podiatrists in the same way that the high street chemist is now pharmacist. We're degree qualified, trained, and often a lot of us have extended scope of practice. So a lot of us can do surgery, we can say do diagnostics, we are prescribers, etc. So we are perfectly positioned to be diagnosing. Now, the problem we have in the NHS and diagnosing at the moment is we literally have a handful of consultants that can do the diagnostics. Social media has had this sudden surge of people recognising themselves as having lipedema, which is fantastic. So they're going to their GPs and they're even self-educating their GPs. But the GPs have got nowhere to send them because there's this bottleneck of having to then get a formal diagnosis. And without a formal diagnosis, you then can't get sent to what limited therapies we have in the UK. So if we don't have surgery available to us, that's only private and you have to go abroad. But what we do have is we have lymphedema clinics who will then take on lipedema patients, but only if there's a formal diagnosis. So again, we have this kind of bottleneck. So we have this resource here that we can have with getting our compression and getting advice and, you know, with sort of like dry brushing and other things that we can use. We then have our ladies over here and they need to get to this. And then, but there's no way to transfer them over without the GP sending them, but the GP won't send them because the GP won't diagnose. GPs are gatekeepers. They're gatekeepers to tell you where to go and get the diagnosis. There are 12,000 registered podiatrists in the UK on what we call the HPC register, which is the equivalent of the GMC for doctors. So we are prescribers and we are diagnosers, and we diagnose conditions of the lower limb or the upper limb, because the lower limb and the upper limb are very parallel. So we are insured to still do the upper limb and the lower limb. What does lipedema affect most? Now, on me, I can probably say that it affects me all over now, and it's actually just starting to affect my face and my neck.
Yeah.
And I'm starting to get it in my cheeks. It's now coming. But my arms are very heavily affected, and my legs and my lower half, and my midriff now, I'm starting to get it. And it's only affected my midriff in the last few years. But as a podiatrist, what do I do all day? I stare at people's feet.
Yeah, and ankles.
And I stare at their lower leg. So feet are attached to ankles. Ankles are attached to knees and hips. I'm looking at lower limbs. And often I'm also looking at hands. So people come in with hand conditions, and we often look at hand conditions. So we are, out of all the other professions, physios and occupational therapists and even GPs, we are probably the best resource to be diagnosers of lipedema. And then we can then send the letter to the GP saying, I diagnose, I'm a diagnoser, I'm licensed to diagnose medical conditions of the skin, and it's still considered a dermatological, even though we know it's a connective tissue disorder, but it's still considered a dermatological condition. I'm allowed to diagnose conditions of the skin and of the body. So I can send that letter referral to the GP and say, this is what I think this is. I'm going to diagnose it. I'm going to put myself out there and I'm going to diagnose this. Yes, we need to get this patient to a consultant, but there's so many years of waiting list to get to a consultant. And even privately, when I sent myself to the consultant, I still had to wait over 6 months, and it cost me £300.
Yeah.
So if we can say, yes, great, still put them on the list for the consultant, but instead of having to wait 18 months or so to see the consultant, to then be allowed to go to the clinic here, we can get that patient to that clinic to start getting the compression therapy so they're not waiting any longer. Because most of us women who are coming forward and being diagnosed, it's at least 10, 20, 30, maybe 40 years we've had this body we've been living with, and we've waited long enough.
Yeah.
We shouldn't be then waiting years more just to be able to get even the most basic compression therapy. And your compression therapy does need to be done by an expert. Yeah. So my next trance into the podiatry world is actually, we don't generally do compression. We tend to send somebody to a compression nurse. Why are podiatrists not doing compression? So that's my next big push into our podiatry world, to say, well, actually, there's something like lipedema we could be measuring. We need a tape measure. Yeah. We could be measuring, and we could be, so the GP can't do that generally. And again, the nurses are clogged up and backed up, and there's big waiting lists. So why not us write a letter to the GP, tell them what the diagnosis is, because the diagnosis is not done by blood tests, it's not genetic testing, it will be soon, it's not yet. There's no other tests we can do, it's just by physical examination.
Yeah.
So if I can then help other podiatrists learn how to do that physical examination, and we make a set guidelines for that, then we can then write to your GP, tell the GP what we need. The GP can then refer you on to say, the clinic over here to go and get your compression, or they can even go and come back to us in the podiatry department, and maybe we can measure and then send off your compression, because we will know how to measure for it. That then, it's not great, because we've still got a near 70 million population, and we still only got 12,000 podiatrists. However, that's almost 12,000 more than doctors that we have, which is literally like on one hand, you can name the doctors who can diagnose. So that way we're going to get rid of the bottleneck to some degree, and we're going to be able to help a lot more people a lot quicker. And as we know, with the whole thing with lipedema, the earlier we catch it, the earlier stages that we do something about it, the earlier stage that we know about it, we can help prevent women get to the late stage. And I'm in a very late stage. So I vary between 135, 140 kilos. And I'm in a very late stage. So it's now affecting my face. It's affecting even my neck. The lipedema is coming to my neck now. It's in my lower arms. It's in my upper arms. It's in my whole body. It's in my breast tissue. I've had several scares over the years because, oh my God, I've got a lump. It's lipedema. Yeah,
I'm the same. Yeah. See, I'm fortunate. I've managed to have surgery in Germany, and I'd say I was the same as you. I had it in my neck, so I've had my neck, my chin liposuctioned, but I could feel it. I could feel it in my neck, and it wasn't like soft. It wasn't soft. It was like the rest of my body. So but I'd say the majority.
And my cheeks here now. Since COVID. And I hate to say it, since my COVID vaccinations, I don't know whether there's a correlation. Be interesting to know if any of your listeners, since having COVID and COVID vaccinations, have noticed a flare in other parts of their bodies. But I certainly have. But my face, I wake up every morning, I'm puffy, I'm swollen. Some days it will go down, others it's not. And I'm noticing that over the period of time, gradually it's staying more and more like it did in the rest of me. And my lower arms weren't really affected until COVID. It really was, but I'm very much here now in my lower arms. But my face, I've definitely noticed. So unfortunately my dad died sort of COVID-related back in 21. And hopefully there's a little bit coming, and I've decided not to pay the mortgage off, and actually I'm going to have some work. So I will be tromping off to Germany or somewhere to that's my next stage in my personal journey with it. But we do need to be spotting people younger. Now, again, in my profession, I often see teenagers, they'll come in with an ingrown toenail. They won't come in because obviously lipedema or anything like this, but they'll come in because of an ingrown toenail. They'll come in because they've got a verruca on it, some little walk virus on their foot or something. And they'll be worried about that. They might have a damaged nail, and they're concerned about the appearance. And then I'm sitting there looking at them going like, wow, your ankles look lovely and slim, the lower of your legs look slim, but actually when I'm looking at the thighs, I'm seeing some early stage there.
Yeah.
I'm looking at your arms because you're wearing a nice short t-shirt because your arms not showing too bad, but actually I'm seeing that ripple effect in those arms. I'm noticing this. And often they'll come in and and they'll talk about how, they've tried dieting, they go to the gym all the time and they struggle to lose weight. And I'm like, okay, I can hear this history. And again, if we can alert people younger and say, we don't know, but it's worth you investigating this. It's worth you looking at this. So even now at the moment, that's what we're starting to do. My initial is I go into conferences now. I was meant to do one in March this year, sadly I got COVID. But I'm doing 2 more conferences this year, and I did one in America. I was over in California just a couple of weeks ago at a nail conference. I was invited over as a guest and a speaker, and I stood up in front of this bunch of women who are all nail techs. And I thought, my God, this is a perfect opportunity. So I went totally, I said, I'm really sorry, I'm going to go totally off topic for a moment. And I'm standing there, I've got this really creative business suit on. So I've got this business suit jacket on, Chanel styled, with trousers, and I'm looking all really, doctory.
Yeah.
And I was standing up in front of this huge group of female, it was all female nail technicians who work in salons and a lot of salon owners. And I just thought, I can't let this go. And I literally just stood there. I had a cami top underneath my jacket. I literally just stripped my jacket off. I took my trousers down. I stood there in my knickers. Thank God I had clean knickers off. I stood there in my knickers and my cami top. And I just stood there and I went, before I start talking about the nail thing that I specialise in, I want to talk to you about lipedema because, statistically, and the statistics are very old research, says 11%, but clinically, we know that we are seeing near a 25%.
Yes, when I listened to your podcast, I found that really fascinating. That it's a lot more.
Yeah. The research is so old, it's so out of date. And I would suggest, from what I see in my clinic, as I'm not specialised, I see more. I would suggest it's nearer 50.
Yeah,
it's nearer 45-50% of women, and I think actually it's pretty much. Most women have it. It's just some women progress and some don't. But that's another theory entirely. Yeah. So anyway, I'm standing in front of this huge audience. I'm standing there actually naked with a cami top and my knickers. And I'm just going right, this is lipedema. I am the most traditional lipedema. If you go and look up lipedema, you will see this body shape is exactly what they show you online. I fit it. This is what lipedema is. You're out there. You're dealing with hands. So you often get the hand cuffing going on like I've got. Yeah. And you can spot this. You're doing pedicures. There's thousands of you. And a lot of you are clinic owners who own multiple clinics. You can go home from this and you can now tell your salon employees to look for this. No, you can't diagnose it, but you can have a little card and you can say, are you one of the 11%?
Yeah. No, that's it.
Look this up, because the earlier you get to know about this, the better. And if it's somebody in a later stage, you can then turn around and say, stop beating yourself up. It's not your fault. We don't need to just be having podiatrists. We need to be, as professionals ourselves, I need to be going out educating the podiatrist. So every time they come into contact with somebody at a nail salon, they're telling somebody. And we can then get people who are not diagnosers, we can make them sign posters. We can make them like the GP sign poster. And anybody can do that. You can just be working in a care home. It doesn't matter. You can be a shop assistant. Anybody that works in an interactive environment where they interact with the public, you can be a signposter. So you can turn around and say, you can be in a restaurant and say, oh, you've got a lovely coat on. It's really nice. At the end, you might say to somebody, look, I know this is a little bit of an uncomfortable situation, but I just wanted to pass this card to you, and it just might be something you might want to look at. Because we're always so frightened. In the forums, I always see it all the time, people are so frightened. Should I tell people I've seen somebody? Should I tell them? Yes. Yeah. Yes, tell them. Yes, you might offend them. Yes, they might feel a bit hurt and upset for 10 minutes, but you know what? It might change the rest of their life.
That's it, yeah. And I suppose... like you said, you don't necessarily have to stand and have a massive conversation. You can just give them a little card and say, look into this. Yeah.
And I know over the years there have been several people that have come up with little cards to use. And again, I think with like Lady Nikki Gregory, who's got an amazing Facebook forum. And I think if we can get her designing up some new cards again, because she's really knowledgeable and she's really good at expressing. Yeah. If we can get some cards done that we can start giving out to people, you just have a couple in your pocket like a business card and you just hand them over, and then you leave it with the other person to take that if they want to or not. They might be in a position where they want to listen, they might not be. Generally, I have found in my profession, I've had one person that got upset with me and was like, oh, how dare you diagnose me? And I'm like, well, actually, at the time I hadn't diagnosed her. I'd said, this is what I have. You know, if you relate to this, you might want to look this up.
Yeah.
But, you know, and that is considering that I have spoken to literally thousands of people now over the years, from going to conferences and going to events and things. So the only way we can do that is just by disseminating the information. The medical profession are not going to disseminate the information for us. It's not a sexy disease. It's predominantly female, but it is not only female.
Yeah.
And in a family where there is a very high proportion of women, you may well find that there will be a man in the family, and you will see it run through generations. I know that because my father had it, and 2 of my sons have it.
Right. Okay.
And one of my sons has been under Dr. Gordon, and won't diagnose him because it's so rare. She won't diagnose him yet. He's 18 with lipedema, but she diagnosed because she was like, well, it's exactly like lipedema, but he's a boy. And so she went, so her get around was, there is definitely lymphedema, and he's been tested for lymphedema, and there is definitely a lymphedema problem. And she said, it seems to be mimicking lipedema, but we're unsure.
Right.
But he's also Ehlers-Danlos syndrome, and we now know that there's a distinct connector. Now, years ago, when I first started flagging up, saying it's really funny that a lot of my hypermobility patients also are very much like in lipedema type patients, and everybody was going, no, there's no connection. Well, actually,
yeah,
very much, and it is now starting to be really recognised that there is. So, again, don't just rule out that just because, you know, yes, it is predominantly a female condition, but there is a small percentage of men, and it is even much smaller than women. I mean, it's really tiny population, but there are men out there that are having it. And so William, bless him, the day before his 18th birthday, got told that he would have to wear compression for the rest of his life.
Yeah.
You know,
yeah,
tough one to deal with. But as I've said to him, now we know that he's 18, you know, I will be saving his inheritance, and we will be spending that early so that he can have surgery, and he will have the liposuction, you know, before he's 21, 22, and that will make a difference to his life.
Yeah.
You know, and he will be able to go and have things done, and he will be able to then wear the compression, and it will make a big difference for him. So yeah, so again, signposting, and then getting those that can diagnose to diagnose. So if we can get specialists, podiatrists, 12,000, if I can get out there and get as many of them on board with me and say, I'm going to conferences and I'm making quite a voice about it. If we can get us diagnosing, that then takes away some of the bottleneck. We can then start encouraging some of the nurse practitioners who can diagnose, because a nurse practitioner who's gone on to do sort of like to say like a mini type of GP type, sort of like basically like GPs will say 20 years, 30 years ago, doing more hands-on stuff. We can get them diagnosing then, and then we get more and more people diagnosing. And there's a lot of nurse practitioners out there, advanced nurse practitioners, who could be doing this. There's a lot of people, nurses, that have gone to do aesthetics, and again, that's a lot of dermatology, and that's a lot of advanced dermatology and their prescribers. So again, they can be diagnosers, and we can get them diagnosing. So my big mantra is get out there and get as many people diagnosing, because that's where the biggest bottleneck with our condition is getting a diagnosis.
Yes, and I'm sure a lot of people watching this will absolutely appreciate you speaking about this, because as I've said to you, I didn't know anyone other than a GP could prescribe. Just as a layperson, it's going to be fascinating, but also for anybody that is in the position to do what you do and to diagnose. So it's amazing that you're shouting about this. It's great.
Yeah. So, you know, I've obviously done an awful lot of background and research work, and so the but the more that I can get out there and get to other people and disseminate the information out to them, you know, that hopefully the better it's going to be in general for everyone. But it's the only way forward, because to say it's just bottleneck of what, great, okay, we're all finding out what we've got, but now we need to officiate it. How do we do that? And to say we need to change the bottleneck. And then also things like footwear. There's an awful lot, people don't realise there's an awful lot with lipedema that we can do with footwear. We can make you walk further, we can make you walk for longer, we can help you exercise better, we can help you learn, because you cannot exercise and do the regimes that other health professionals will tell you to do. So a lot of physios don't understand, especially, you know, they're getting better with the hypermobility side of things, but because you're generally hypermobile, even if you don't look hypermobile and you don't fit the single Benson scale, you don't fit on that. However, there is still this internal hypermobility of the tissues. And so because of that, you need to exercise differently. You can't follow the standard exercise plans. But again, we can then teach you different ways of exercising, you know, looking after your feet, looking after your footwear, keeping you more mobile. There are different particular sandals out there that are actually really good for lipedema feet and will fit lipedema feet and ankles really nicely. And we are more aware of what those are now. And also, interestingly, there's a new laser therapy out. Now, again, we can't jump up and down about it. And there is no research because nobody is paying for the research for this. However, there is a small group of us who have hypermobility, the fibromyalgia conditions, and also have lipedema, who have this laser equipment. And we've been basically doing the Marie Curie thing, and we've just been experimenting on ourselves.
Yeah.
And at the moment, it's actually looking really, really interesting. I've had a laser machine now for about 3 months, and I've actually been doing one leg against another leg, but I've actually taken 3 inches off one leg. Okay.
So for anybody that wants like a basic explanation, what's the laser treatment entail?
So a laser is literally like a laser light. It comes in a little probe. I should have one actually. It comes. Maybe we could do one on that.
Yeah.
But it's like a little probe, and the laser light is calibrated. It's a bit like going under a sunbed, but it's a particular part of the light spectrum that is focused. It's not hot, it's not burning, but it's focused to go so deep into a certain amount of tissue, and you can calibrate it to go to certain particular depths, and it goes in, and on a very basic Mr. Man book level discussion, it kind of goes down and it excites the cells at a cellular level, and it kind of makes the cells go into a kind of natural repair healing. Now, I was going to this conference in Canada a couple of weeks ago, and I had this like cellulitis bump come up on my leg. And I'm going, oh my God, I've got a 12-hour flight, and I've got it looks like cellulitis is coming up on my leg.
Yeah.
And there was like this lipedema kind of lump, which had just suddenly appeared, and it was really painful, and it was like burning. And I was like, oh my gosh, what am I going to do? And I thought, you know what? We use the laser in my clinic for soft tissue therapies generally. And I've been using it on my leg, and I've noticed that some of the lipedema kind of lipomary lumps had actually been going down, because I've been taking it home at night and I've just been using it on myself. And so I thought, oh my God. So I said to my husband, it's like 2 nights before the flight, I said, my God, can you just get the laser out and and you just waft it up and down over the skin, and it just, it agitates the soft tissue. It helps inflammation and edema reduce. It helps the body reabsorb, encourages that. Anyway, within 24 hours, this cellulitis had gone.
Wow. Okay. Now,
this is just one person working on me. There's no research. This is just totally anecdotal. So we can't be jumping on the bandwagon. There's no research about this. But when I use this on myself, and I was just like, wow, actually, maybe we do need to start going to the companies who have these machines and say, look, can we actually look at doing some research? I was a podiatrist. I have another podiatrist, 2 other podiatrists actually, who both have lipedema. And so we've been working on the laser on ourselves, and the other people are having similar results. So it's something that maybe actually where we're being told there's nothing but having surgery, it is a very vague hope. But to be honest with you, as a patient myself, I'm going to like to try and hang on to a little bit of hope to get me through. I'm 52 now. I need a bit of hope.
Yeah.
But there might be some hope on the horizon with not just having all the compression therapies, that actually there might be something in laser that might be worth a breakthrough. It is a long way off at the moment, but there looks like it could be promising, and there looks like there could be something in it.
Yeah.
So it's watch this space.
Yeah, that sounds really
interesting. And if anybody does want to come, I don't charge like a standard appointment for treating women and looking at them, but we can do Zoom calls now. COVID, thanks COVID, we can do Zoom calls. We weren't allowed to do telemedicine before COVID. COVID comes along, so you can't see a patient, but you can talk to them on the phone.
Oh, right.
Fantastic.
Yeah.
So we can now do telemedicine. And again, yes, you really need to be able to feel somebody, but you can certainly say to somebody by just looking at them, if you know what you're looking for, looking at them even over a video chat, you can go, I think it's worth you going to see somebody.
Yeah. Well, that's how
going down the lines of, no, I think you're worrying, your sister might have it. I don't think genetically you're going down that line. I think you're okay, and certainly okay at the moment. So even just doing something like these kind of video calls, you can often just spot it. I mean, and once you actually know how to do the diagnosing kind of criteria, you're walking down the street, you're seeing so many women, and you go like, oh, yeah. Yeah. That's a lippy lady.
I know. I spoke to one of my doctors recently, and he said that they just spot it now, and that's how they do the diagnosis over a video call, because obviously they're so used to seeing it, they know what they're looking for. Obviously, like you say, it's ideal to be able to feel, but there's more to just the physical aspect. It's also the pain and the discomfort, and so when you can talk to somebody about that, that's like a really big part of it.
But certainly the later stage ladies, once you get past sort of stage 2, it's really obvious. It's the history of the dieting, the history of the exercising, the history usually of you starving yourself, the history of you feeling really depressed because you feel it's all your own fault, and the history of the anxiety, and then all the mental health issues that go with it. Once you put that all into a bubble and you look at somebody's wobbly arm, you go,
that's it.
It's a bit of a no-brainer, really. And it doesn't take a degree to work that one out. Quite honestly. But yeah, it's interesting times, and it's so fantastic that there's people like you that are doing these YouTubes, and as I say, and we've got all these Facebook groups that are fantastic that are coming out now, and the word is getting out there. As I say, my biggest thing I do now when people come in and I just sort of accidentally seem to spot it on them and go like, oh, this is this Facebook group, you might want to just pop yourself on there and go and have a snoop around, and this is a website, just go and have a look and see what you think, and if it kind of resonates with you, come back and have a chat with me.
That's a great way of doing it. Because you find like a lot of people who go to a GP are often dismissed, and even though it feels weird going up to somebody and saying you might have this, I imagine a lot of people that have had a bad experience at GPs would have liked that to have happened to them, myself included. As a teenager, I was very self-conscious, but if somebody had said, I think you have this, it just changed my life. It really would have.
Gosh, if somebody had come to me when I was 18, 20 and told me the things, the mitigating that I could have put in place to stop me getting to the stage I am now, the anti-inflammatory eating, eating differently, so you can still enjoy a really nice range of food, but you just have to differently, and I would have just my whole lifestyle would have been so different. I wouldn't have tried to take myself to the gym and then have killed myself and then joined the gym, been there for 3 months, done so much harm to myself, it took me 6 months to recover. And then it made it worse.
Yeah.
So just kind of knowing those basic things, actually, you know, go swimming, don't go running.
Yeah, no, I know.
Stupid things
Yeah.
like that.
Yeah.
You know, it's like, if I'd have known these things back then, as I say, my life would have been so less painful and so much better. But yeah, I mean, I'm at a stage now where I'm in constant pain. It's not a matter of what pain, it's just a matter of what level of pain I'm in this day.
Yeah.
Am I in the level of pain where I can get out of bed, or am I in the level of pain where actually I can get to work and I can treat 15 patients today?
Yeah.
You know, some days I can. And it's getting to the stage now where one day to the next I never quite know where I am and what level I'm going to be at.
I think a lot of us probably don't know how much we are used to pain as well, like how much you kind of accommodate for having pain and discomfort, and you kind of just accept it because it's always there.
Yeah, exactly. Yeah, and it's kind of, I remember when I had my last son, William, he's now 18, and when I was in labour, and it was really painful and it was uncomfortable, and I had a private midwife at the time, and she was going to me, well, you know, would you like some pain relief? I'm like, oh, no, it's just kind of just a bit more than my normal pain.
Yeah.
And I didn't realise that actually, you know, that actually my background normal pain was kind of akin to kind of like halfway through labour.
Yeah. Yeah. Yeah.
And then something sort of twigged. I'm thinking, oh, actually, this isn't much more than I'm normally. Yeah, okay, I'm having these odd spasms which are a bit uncomfy in between. But actually, this background achy, my back's aching, everything's hurting. You know, my lower bits are hurting. That's just kind of normal.
Yeah, yeah, and yeah. I think that's it. Like I remember in the podcast you did, which I will link below, because it's absolutely brilliant. And I said to you before, you speak so well, and it goes through your journey with lipedema. You mentioned that you, which really stuck with me, that you didn't know other people didn't have painful legs, and that really stuck with me because I've always had that. It's always been certain areas that if I touched them, it was, I can't describe it. It's like being cut with glass. That kind of really sharp skin pain.
I always described it as like it's like having a shark bite you.
Yeah.
Sometimes. Like, sort of like, so the cat might jump on my lap, but it felt like actually it was a shark biting my leg off.
Yeah.
And it would be, I was like, oh, God. So the poor cat used to get terrified of jumping on my lap because every time she jumped on me to have a cuddle, and I'd pick her up for a cuddle, and she'd go, no, don't pick her up for a cuddle, and scream.
Yeah, and when you said that, it really resonated with me because through, like, since I was very young, I'd say about 8 or 9, I've always had that pain, especially in my arms as well, and I just thought that was normal. So you don't say anything really, and it's because you just think that's normal. Yeah, and it's that's when speaking to somebody like yourself or another professional would be fascinating. And it, even now when I see things online, I'm like, oh, that's related to lipedema. And like you say with hypermobility, I don't have is it ES? I can't remember what the
EDS.
EDS.
Ehlers-Danlos syndrome.
Yeah, I don't have that, but I do have the hypermobility in my joints.
See, now that's the thing. That's often now being reclassified, and it's more likely that if you are EDS, you just didn't fit the previous criteria for it.
Right. Okay.
But actually, what they're finding now is that the EDS isn't all about just the hypermobility. It's about hypermobile tissues.
Right.
So you might have some hypermobile joints, but not have hypermobile skin.
Yeah.
But actually, internally, one of the reasons why it's so linked is because you have this compression pump. So when we walk, what happens is our muscles contract, and that should push the fluid back up. And gravity takes the fluid down, and then we pump it back up to our hearts. So the blood goes down, and then all bits out of the components out of the blood, and fluid all sort of like leaks out into the skin and into soft tissues. And then our muscles contract and pump that all back into our lymphatic system, which pumps it all back again for us. What happens is that the tissues that control the lymphatic system are leaky because they're too soft and squidgy, because they're made of the slightly wrong collagen. So that allows everything to leak out a little bit. And then when we walk, the muscles, because we're a bit more mobile, don't pump very well. And so because they don't pump very well and we've got leaky vessels, it all just stagnates down there. And then because it stagnates down there, the fat cells go, oh, there's all this extra fluid down here. Maybe I should help the body by sucking it up. So the body then sucks, so the cells suck it all up, and then the body goes, oh, hang on a minute, you were not meant to do that. That's not fat. That's the wrong fluid. I'm telling you off. And then what it does, it goes, I don't know what to do with you now, cell, because you've now sucked up the wrong fluid. I tell you what, I'm going to put a little capsule around you, and because you're a bit stretchy, I'll just shove you out of there, out the way, and I'll forget about you.
Right.
And that is exactly what lipedema is.
I guess that's why we float as well, isn't it? It float in water.
Because then what happens is the cell that the body's encapsulated, the hormones can now no longer talk to that cell,
right,
because it's kind of been put in jail, cell jail over here. So the hormones that would say, oh, you've been doing lots of exercise and actually you can release that spare fat you've got now. And the fat cell goes, oh, but actually I'm not really full of fat, I'm full of these other fluidy bits. And so then the body goes, oh, well, then I'll just leave you alone. And then you lose the bit of fat, normal fat that you have. So that's why when you lose weight, and we often do lose weight. I have, because I've gone from being 28 stone and then I've gone down to being 17 stone back in my 20s. I did lose weight, but nothing came off the lumpy legs at all. And so, but I lost it everywhere else, and I actually literally looked emaciated on the top half of my body, and my legs were still like a 24 pounds.
Yeah, yeah. So this, I don't know if this is a question you can answer. It's just something that's always fascinated me. A lot of people with lipedema say their weight doesn't correlate with how they look. Will that be because it's the fluid? Because obviously fluid's heavy. I'm guessing that'll be why. Because I've always felt like that.
When I was younger, even at 28 stone, I didn't look 28 stone. Yeah. I probably looked more 21 sort of stone. I didn't look what I did. As I've got older, it's bizarre because now at 52, I actually weigh the same as I did, you know, say 10 years ago, but my clothes sizes have changed now. Which is a bit strange. Yeah. So it's kind of like it's sort of gradually got a bit sort of, I don't know, I'm now filling out a bit more, and I think that's all because I've just gone through the menopause and things like this. So, and I finished the menopause all over lockdown. That's like great, couldn't get any help. So in the end I just cold turkeyed the whole menopause. I didn't get hormones at all. But since then, all of a sudden I just exploded. So where I've managed to keep myself in a kind of a size 18, 18, 20 top, but I'd still always been a sort of 26, 28 bottoms. I'm still kind of a 26, 28 bottoms, but now I'm like a 26 top. Yeah, yeah. And it's just like, and again, every time I've starved myself, like I got married, Mark, he's not the first husband, but that's another story. Yeah. Number 4, actually, but again, that's a whole long story. Needs a glass of wine for that one. Yeah. So when I married Mark, we got married in 2016. God, I'll be told off if I don't remember that correctly. But we got married on the 4th of May because we're a bit geeky, so it was May the 4th be with you. Yeah. So I literally starved myself for 3 months before that because I knew I could probably get a little bit out of my face and tops my arms. And then I had this most amazing dressmaker who made me this. We did steampunk Victorian theme wedding because it was just for a bit of a giggle, really. Yeah. And so I had this lovely Victorian outfit which clinched me in at the waist nicely, had puffy arms to cover my arms up, and then had like a big puffy Victorian skirt, so covered everything down below. So if you look at the photo of me in that, I don't look like I'm even overweight, let alone got lipedema. There's one fantastic photo that I really love. I'm hanging off the back of the Victorian tram and kind of waving. And I just look really skinny. And I'm like, oh my God, it's my favourite ever photo of me. So the only photo as an adult, I look quite skinny. It's amazing what you can do with a bit of clothing and a bit of theatrics. And it wasn't Photoshopped. I think I did Lighter Life. I did the Lighter Life diet thing, and that was like the soups and drinks. I would not recommend it. No. Because yes, it's great. It's great. You feel fantastic, and it's terribly hard, and you're starving yourself, and your hair falls out because you're starving yourself, and then you might lose something, and you might change your body shape for a little bit. But do you know what? 3 days off it, I put a stone back on. Yeah, this is it. It's not sustainable. And then your body with lipedema goes into this crisis, and then it just goes mad, and you just explode. And that's why every time you go on the diet regime, you lose the weight, you gain it, and you put more on.
Yeah.
And so the diet cycle is the worst thing we can do for ourselves. Absolutely the worst thing. And if I'd have known that when I was 18 and had just enjoyed eating instead of constantly being on around 800 calories a day, and I was, actually when I was younger, even though I was big, I was basically anorexic.
Yeah. I bet that happens a lot.
Yeah. So I was a fat anorexic.
Yeah.
And of course, then there's no help for if you're fat and anorexic.
No, because of BMI.
And so, yeah, exactly. So it's just ridiculous. There's just no, it was like, oh, well, you just have no self-control. You can't help yourself. You can't look after yourself. And then you're told this so many years, so often, how it's your fault, it's your fault, it's your fault, it's your fault. And after a while, you start to believe the mantra, it's your fault.
You do, yeah. And it's a hard thing to let go as well. And yeah.
And again, because we have so many negative experiences with medical professionals, we then become actually phobic of medical professionals. We avoid them. So actually then when we really are genuinely sick, we end up until we're at death's door and get ambulanced into A&E because we won't go and get any help.
Yeah.
I was like that with my asthma for years, literally until I was dying on the floor. Family would finally call an ambulance for me and take me to A&E, and then I'd have to be in hospital for a week because I'd let my asthma get so bad and I had a chest infection and pneumonia and all these things going on because I just was too frightened to go to the doctor when I had a bit of a mild chest infection and could have had some antibiotics and got it sorted.
Yeah.
So again, we're not doctors. Not in the UK, in America they are, but we're not in the UK. We're not doctors. We do a standalone degree. It's a paramedical. It runs alongside medicine. So we learn a lot of medicine, but we specialise in podiatry, and we work for 3 to 4 years specialising in this. And so often actually people see us as actually not quite as confrontational. So approaching a podiatrist who is lipedema savvy, or even podiatrist who has lipedema, is a lot less scary to actually finally be able to go to a medical professional and say, I think this is what I have, can you help me?
Definitely.
Or I've heard about this, can you help me? So I think as well, what will help people in the long run is the fact that to say we're not scary, we're much easier to come and approach, and we tend to have much longer appointment time. So on average, we tend to spend 20 minutes with a patient to 40 minutes to an hour with a patient, as opposed to a GP that gets like 5-10 minutes.
Yeah.
So again, coming into seeing somebody like myself, we're a lot less scary, and we're a lot more easy to approach. We're a lot more easy to get access to.
Yeah.
So and again, if you're out there, if you're watching this and you're out there and you've been scared, please don't be. Please don't be scared. There are a lot of us out there now. It's myself and there are other colleagues, and we can help. And you don't need to be scared of coming back to medicine. There are medical professionals out there now who are understanding and we're listening.
Yeah.
And actually, that was really highlighted. I had a student in with me yesterday. She was a final year student doing podiatry. She's just about to graduate. And the first thing I said to her was, well, welcome to my clinic, and I'm Nicola, and I have this, and as you can see, I wear tight trousers, so my legs are very obvious in clinic. And I said to her, these are my legs, and have you heard of? And she went, oh yes, I've actually heard about this. And I was like, oh my gosh. It was just like, wow.
Yeah.
You've come from your university and you've heard about this. It was like, wow, that was just amazing.
Yeah.
And so it is gradually getting there. It's getting out there, but we just got to keep pushing at it, and I will keep fighting.
Yeah, that sounds great. So I think we'll wrap it up here, but I'm sure I'll definitely want to speak to you again because you're very knowledgeable, very passionate, and it's brilliant to hear kind of the science behind things. I think you go on Instagram or Facebook and people are saying, do this, do that, but without any backing. Yeah.
Well,
there's just no
it's
backing.
It's like my podiatry degree overrules your Dr. Google.
Yeah.
As I often say to people.
Yeah, and you see a lot of people saying the same things because they've heard somebody else say it, and it's just.
And so it's like that misinformation.
Yeah. Well, thank you so much for your time today. It's been really useful, really interesting. I did listen to the podcast you did with Tyson Franklin. I will link it below because I think everybody will find that really interesting. I did, definitely. So I definitely recommend listening to that. And yeah, thanks again so much for everything you're doing as well, because it's going to change so many people's perspective, like you say, going to medical professionals, but also hopefully changing their life.
Yeah.
Yeah.
Brilliant. Well, thank you. It's been an absolute pleasure.
Oh,
I've thoroughly enjoyed it. So thank you.
Thank you. Thank you so much to Nicola for joining me today. I find it so fascinating that there's somebody out there who's had this idea and she's completely running with it. So yeah, brilliant to speak to you, Nicola, and I really hope we get to do another video soon because I just think you're fascinating. So if you'd like to follow me, my Instagram name is @fat_bottom_Amy. Thank you for joining me today, and I hope you'll join me for the next video. Bye.